Good afternoon, everyone. My name is Dr. Adeleke. Thank you for asking me to give this talk on preventive health services in men and women. Uh, we'll be talking about common risk factor for non-communicable diseases and the level of prevention. What we need to do to prevent these diseases. All right, so talking about risk factor for non-communicable diseases, some of them are genetic, they run in the family. Some are things in the environment we're exposed to. Some of them are just social demographic factors, things like age, gender, races, and ethnicity. But the more important ones are the lifestyle related risk factors, things like tobacco use, alcohol use, a level of physical activity, our weight, the choice of food, and our dental care. Of course, these have been found to be significantly associated with development of non-communicable diseases. There are other medical conditions, things like hypertension, diabetes, that can also predispose to other uh, diseases. Now, the chunk of this talk will be on the level of preventions. So, what are those level of preventions? We have primary level of prevention. Before then, we have primordial level of prevention, primary level, secondary, and tertiary level. In primordial level of prevention, basically, we are looking at the general population. We want to eliminate the risk entirely from the population. For instance, we talk about things like banning tobacco smoking. That's a primordial level of prevention. In primary level of prevention, we look at the risk factors in the susceptible individual, and then the individual now take practical step to reduce the risk. For instance, somebody who is living a sedentary lifestyle becomes more active by doing regular physical activity. That's primary level of prevention. In secondary level of prevention, what we do here is we target individuals who don't have symptoms of diseases. We screen them early so that we can identify those who have disease and then take necessary step to prevent the progression of diseases. In tertiary condition, we'll look at individual who already has the diseases, and then we'll counsel them to take their medication regularly and give them all the support to prevent onset of complications. So those are the different level of prevention. So if you do all of this, we shall be able to enjoy higher quality of health and will live longer. So thank you very much once again for giving me this opportunity to talk on preventive health services. Thank you. God bless and enjoy good health.